Hi, I'm Dr. Newman from South Bay Plastic Surgeons. I'm a fellowship-trained breast and plastic surgeon, an expert in breast surgery. And I'm going to talk a little bit today about where the implant could be placed. So specifically, Kylie Jenner recently announced that she had 445 cc implants, just like this implant here, placed halfway under her muscle and halfway not under her muscle, called a dual plane. And the surgery that is involved in that is releasing part of the muscle where it attaches to the ribs so the muscle can slide up, allowing the implant to be halfway under the muscle and halfway under the breast tissue. That is the most common placement for breast implants. Now, there are some other options that you should be aware of. One is the implants can be totally submuscular, in other words, covered entirely by the muscle, or totally on top of the muscle, which some people call subglandular or subfascial. Now, any of these options could work for any patient. It really depends on your anatomy. And so you should definitely come in and see one of us here at South Bay Plastic Surgeons so we can figure out which plane or which position is the best for you and your breast augmentation goals. Kylie Jenner announced that she got a 445 cc moderate profile implant placed. And now a lot of people have asked why she chose a moderate profile implant instead of, let's say, a high profile implant, which is right here next to it. The same volume, but a very different shape. So you can see it's narrower and more projecting. And what that means is it sticks out more in front of the chest, and it's better for people that have a narrower chest. So for people that have a wider chest, like Kylie, maybe wider shoulders, and want a more natural look, a moderate profile is the best choice. Many patients are asking us, how do we get the most natural result for breast augmentation? Well, it definitely has to do with projection. So here we've got an implant around 450 moderate profile and an implant around 450 high profile. And you can see how that would lead to a very different result. However, the real difference has to do with volume. And so to get the most natural result with breast augmentation, you really need just a smaller implant. So the smaller the implant, the more natural your result is going to be. Another factor has to do with how much breast tissue you have on top of the implant. So the more breast tissue you have covering the implant, the more natural the result is going to be. So don't forget, when you're looking at before and afters, make sure you compare a before that looks like you before you go try and achieve the after results that you're looking for. And so a lot of people have been asking us now, well, when should I have my implants put in? Should I do the implant surgery before having kids or after? And the truth is, it depends. Either one could be appropriate. So having implants before kids is totally fine because usually most people are able to breastfeed after children. But it is true that when you have kids and breastfeed, your breasts do change. So some people prefer to wait till after children to wait until their skin stretches out and then put the implants in. So the bottom line is either way is reasonable, but the best thing to do is to come in